As we had said, we would now have time for questions and answers. I'm trying to look in the chat box, and maybe also the speakers can do the same at the same time. But let's start with the first one, maybe. There is a question. It says, in Dr. Tan's presentation, you mentioned the importance of Healthcare Service Act in promoting patient safety. Could you discuss the implications for countries that do not have similar legislation in place, and what steps they can take to ensure patient safety without such a framework? Is that something that you could address, Dr. Tan?
Well, I think firstly that when we analyze our incidents, we know that there's a law that we come together. All the information that we discuss cannot be subpoenaed into the court. If there is a legal suit coming on, it has to be a rediscovery process. So that whatever we discuss within it is safe, because what we want is for people to be open, frank, and to say what we can improve. So that is the culture of openness. And the culture of openness, as in the first Global Patient Safety Action, there has to be a policy that encourages this kind of behavior itself. So it's actually a mutual thing. Firstly, those healthcare practitioners who wants that should lobby the politicians and maybe their healthcare leaders to put it to the parliament or in their own system to be able to ensure that there's a policy for them to be open and frank. So it's actually set up within the Global Patient Safety Action Plan that there should be a policy by the leaders. I don't know whether Dr. Neelam has interpret this as it is.
Yeah, Dr. Neelam, you want to add something to this?
Oh, I think Dr. Neelam is
frozen. Yes.
Yeah, frozen as well. So I think that's important. And for those who don't have it, well, then you really have to have additional work, because it is just not enough for the healthcare workers to be open and transparent. There has to be a law that give them the coverage and the protection, and it has to be done. That's why we have the ministerial summit meetings to ensure that the ministers understand this as well.
Right. Yeah, thank you. We can wait for Dr. Neelam to come back, but while we're waiting for that, maybe
Dr. Neelam is back, I think. Yeah.
Is she back?
I'm here.
Okay,
Yeah.
okay. So, Dr. Neelam, do you want to add something to what Professor Tan already mentioned? I think
Dr. Neelam, yeah. Okay.
Dr. Neelam, can you hear us? Yeah, I think we're having a technical issue here. Maybe Dr. Neelam wants to log off and log back on. So again, while we wait for her,
I'm really sorry. I don't know where the problem is, but I was not able to hear you. So I'm back now with you.
All right. Okay. So Dr. Tan, maybe in a few words, you can repeat what you said so that Dr. Neelam can react to them.
Oh, yeah. So I'm saying that under the Global Patient Safety Action, the first one is the policy to be able to be transparent, right? Because healthcare workers, they want to be open about, when the center event, they want to be open, and there's law that actually protects them, so that if they say something, it would not be, subpoenaed to the court. So I think it's important for that. So I understand the Global Patient Safety. The first strategy is to have this policy as well, right? Open a mindset of target zero, and yet the policy will allow for that, right? Facilitate that. Right?
Absolutely. So I think there are two important components, as you mentioned, amongst many others. One, of course, is that you have a mindset of zero harm, even if you may not be able to achieve really zero harm, but you have to aspire for zero harm as the vision. So that's when we're developing policies, we should have a mindset of zero harm, and it's beautifully captured in the vision in Singh Health as well, through IPSQ having a target zero. The other one is, actually having openness and transparency in the system so that we could learn from what has gone wrong in the system, the harm which has happened, and how do we capture those incidents and analyze the information, and then bring about change in policies and practices to improve patient safety. So fundamentally, safety culture, transparency, and openness is extremely vital. You elaborated also on disclosure. So I think that's another very important component of legislation, that a policy and disclosure and even apology to those who have been harmed in healthcare, because that really keeps the trust between the healthcare system and the patient. So recently we've been working on patient safety rights as well. And the several countries are now prioritizing looking into how rights of patients could be upheld, and how safe care is actually a human right. So right to health, of course, is a fundamental human right, but it should not be just right to health while we are actually, through unsafe system harming patients. So important to identify the component of safety when we're looking at human right as well. So there are a lot of initiatives going on in this, and actually WHO is working on a patient safety rights charter, which would be launching, in a couple of weeks' time, and that looks into different components and what are the patient rights for ensuring that the patient receives safe care. Thank you.
Yeah, thank you so much. There are a few more questions in the chat box, and I think they're mainly for WHO. The first one is, how can accreditation bodies collaborate with WHO to further enhance patient safety outcomes on a global scale? Dr. Neelam?
Extremely important question. Accreditation bodies are as important a global partner for patient safety, as any other organization internationally. Because accreditation agencies are working with healthcare facilities and systems to reach up to a level of standard. So in this process of defining benchmarks and standards, actually working with partners and countries and healthcare facilities to reach those targets. And WHO, although itself is not an accreditation agency and does not directly provide accreditation to healthcare facilities or organizations, but works with them to develop standards, to develop tools and resources, so that these standards around the world, which are different accreditation agencies have, they could be harmonized. And we are also looking into some sort of minimum safety standards, which we are going to reach out to accreditation agencies so that they can adopt those standards as part of their standards for accreditation. So there's actually an important initiative which we'll be taking hopefully later this year or early next year on working on minimum patient safety standards. And this is one of the important action which the World Health Assembly resolution has asked WHO to work on. And during this journey of developing these minimum patient safety standards, we are going to work very closely with all organizations who are involved in standard setting, have a standard setting role, and work with healthcare facilities and organizations to reach those targets as well. So it's not only just an audit, but actually an improvement journey to reaching to a minimum safety standards.
Great, thank you. Of course, this field is not a static field. There are advances in medicine and in technology and healthcare technology. And there's a question about what are some of the emerging patient safety challenges that the WHO is closely monitoring or addressing?
So definitely the role of technology and digital technology and AI is something which is really evolving. And where digital technologies can be a solution, and they are solution for improving patient safety around the world. There are several digital solutions have been applied, clinical decision support systems, one of them, and several digital tools also for improving medication safety practices. There could be also challenges when we're introducing digital solutions. They can also, have their own risk of harm. So I would say in terms of emerging issues, technology is one of the most important issue. The second one, of course, is what we have learned during the pandemic, and Professor Tan has as well mentioned, WHO also did an extremely important scoping review on what were the implications of the pandemic for patient safety. So while the countries are working towards strengthen their systems and develop resilient health systems, we have to ensure that our learnings from pandemic situations, in future, if we ever face a situation like this, we are not challenged into, major patient safety issues, patient engagement issues, as well as health worker safety issues. So those are another important areas which we're looking for and taking action on.
Thank you very much. Professor Tan, there's also a question for you in the chat. It's against the background that in Asian countries, there's very often a very hierarchical structure with an authority gradient, which is very strong still in Asian societies. And so the person, Hian from Malaysia, is saying, I'm interested in how psychological safety is framed as an integral component of the patient safety in Sing Health. How do Sing Health leaders promote psychological safety among their team members? Professor Tan?
Yeah, well, this is actually a very important question. In fact, Sing Health is looking at this in a very big way itself. And we actually have various programs to actually promote psychological safety. One of them could be very simple. For example, our previous group CEO, Ivy, and now our current CEO, Wai Ho, they tell us, that please do not call me as Professor Ng. Both of them are Professor Ng anyway. Call me as Ivy or Wai Ho. It is now a rule that when you talk to your leaders, you address them in the first name basis itself. That itself is actually a leadership role model. And we have speak up programs where we teach our staff. In fact, we have reached up to like 80 or 90% of staff who have attended this workshop to be able to speak up in the step-up ways, respectfully, to raise concern, to raise issue that might be problematic. And we tell them that actually it's important because you're speaking up is actually to protect the other person, no matter how senior the person is. And the person who replies has to say thank you, even though it may be wrong in the first place. For example, it may be mistaken. And this is becoming a culture within that. And our leaders, our top leaders, they are role models. They do the videos for us. They show examples themselves. So basically, it is actually very strong in the Asian culture, but you're trying to change that. And it's the leaders who can change that. And we are trying to change this mindset. As you say, it's actually a mindset. And psychological safety is the number one thing that you need to do, in fact, to improve patient safety, because it is inherent in the learning system. If you don't have psychological safety, your learning system cannot work. And there will be errors that's not reported, and there will be, will be delayed and all that. And we feel, in fact, recently our new group CEO, he said the number one thing he's trying to improve the psychological safety of the whole Sing Health cluster system. Because he thinks that if you can do that, there is a winner in terms of moving the organization forward. Yeah.
Yeah, thanks very much. Neelam, another one for you on different country types. And the question is, low resource and high income settings, are there any different or differently supported in their efforts to improve patient safety? And can you also tell us about the unique challenges facing between them? So that if there's a different approach between support to low-income countries or low-resource settings and high-income settings?
Extremely important question. And I think before I take that, I want to just dwell on what Professor Tan was mentioning about psychological safety, because this is truly a challenge in LMIC countries where still a blame culture is very prevalent. And there's a huge issue of hierarchy as well. And so that really is a major barrier for improving patient safety and getting the health workers engaged in the system. So a long way to go, I think, in addressing how do we turn the blame culture into just culture. And so Singapore is an excellent example where psychological safety is prioritized. extremely important for leaders to recognize the importance of psychological safety and, and transparency, and not really have blaming people if something goes wrong. But we need to develop systems, and that particularly healthcare leaders need to be fully sensitized and introduced to the importance of psychological safety, and move away from blame culture and the hierarchical system. Now, coming to how do we support high-income countries and how do we work with low and middle-income countries, are the issues different? So broadly speaking, when WHO provides guidance or tools for any specific area related to any topic, particularly say for patient safety, our guidance is very broad and generic so that it can be adapted at different levels, different settings, different categories of countries. Because the context can be so different around the world, the challenges can be so different. Even in a high-income country, there could be centers which are facing similar situation as blame culture, for example. So the guidance is generic in all situations. When countries and healthcare organizations implement this guidance, they actually need to adapt it to the local and the national context. So, and then if they are specific, when we work specifically with countries based on their, requirements or their request, then we go deeper into what are the issues. And definitely the foundation of that would be a broad overview and an assessment of where the gaps are, whether the gaps are in terms of policy gaps and whether the leadership is engaged or not, whether they have prioritized patient safety. So the solutions also depend on where the gaps are. If patient safety is not prioritized in the country, the policies will not reflect it. We will not have resources. It will somehow be always seen optional and not really given, seen something like an add-on which has to be done. While you're improving access, we can say look into safety later on. So it's extremely important how the policies actually are, and the guidance is, and the tools are adapted to local context. So in terms of challenges, I would say in high-income countries particularly, the challenge may be patient engagement is truly a challenge globally, I would say. So this is something which we are really asking countries to prioritize, looking into more and more, hospitals and healthcare leaders to bring patient representatives into the health system governance and health services governance mechanisms. And only 13% countries, have reported it. And it's most of the hospitals, they don't have such systems. So I would say broadly speaking, whether it is a delivery gap or knowledge gap or design gap or communication gap, all these gaps exist across the globe, whether it's high-income country or a low-income country. And then depending on where the challenges are, then those need to be addressed.